The case of Mr. Stuart J. Wright, a paramedic previously employed by the Scottish Ambulance Service, went to trial before the Conduct and Competence Committee in November of 2019, where he was found guilty of 13 instances of misconduct during the course of his employment. This resulted in him being struck off from the paramedic register as he was deemed unfit to practice. In this video, we will discuss these episodes of misconduct, such as his negligence to provide appropriate care to his patients, his failure to keep adequate patient records, and his improper administration of morphine. We will also discuss the instances in which he caused delays to respond to emergency calls and his failure to use lights and sirens when responding to emergency calls. Due to the numerous allegations against Mr. Wright, we will be detailing only select events, namely inappropriate patient assessment and observations, negligence in treatment and drug administration, various delayed responses, and failure to properly utilise emergency codes. The Ambulance Services Act 1991 is a legislation passed by Parliament to allow Queensland-based paramedics an organisational structure that enables them to more effectively apply care and to regulate the timely, relevant and comprehensive healthcare they provide to all Queenslanders. Any omission or action that is in violation of the Ambulance Service Act 1991 allows for disciplinary action to occur. With this in mind, we are able to identify that Mr. Stuart J. Wright is in violation of the Ambulance Services Act 1991 regarding the incident reported on the 10th of October 2016. In this incident, Mr. Wright and a colleague responded to a 78-year-old male patient who had fallen and suffered possible neck injuries. It was noted from Mr. Wright's colleague that the patient had cervical spine tenderness, meeting the QAS policies and procedures that state the suspicion of a cervical spine injury requires for a cervical collar to be placed unless contraindicated. Mr. Wright ignored policies and procedures, arranging for the patient to be walked out of the property to the ambulance without cervical immobilisation. Mr. Wright, as a paramedic, owed a duty of care to the patient, and his action and inaction breached his duty of care specified within the Ambulance Service Act 1991 services functions. Although within the hearing, damage or harm caused by the inactions of Mr. Wright are not specified, all elements of negligence may be accounted for. Mr. Wright's negligence also extends to his inadequate recording of observations. On the 9th of October 2016, the required observations of respiratory rate, oxygen saturation, pulse rate and blood pressure were not taken, and a systolic BP of 90 was recorded, although Mr. Wright admits to not using a cuff to measure the blood pressure. On the 21st of August, Mr. Wright had administered 5 milligrams of morphine, a Schedule 8 medication analgesic which affects the central nervous system and may cause respiratory depression. The QAS pain management guidelines state regular reassessment should occur every 5 minutes for a patient with severe pain. Following administration, Mr. Wright failed to monitor the patient for adverse effects and even administered a further dose of morphine without performing a pain assessment. These events succeeded Mr. Wright asking an ambulance technician to unlawfully act outside their scope of practice by administering morphine. On the 2nd of January 2017, an emergency call was communicated to Mr. Wright at 7:50 a.m. to attend a road traffic accident. Mr. Wright was due to go off duty at 8 a.m. whilst his colleague would continue his shift with another paramedic. When the ambulance arrived to collect Mr. Wright's colleague, it was by the other paramedic instead of Mr. Wright. This means Mr. Wright delayed the response to the emergency call on purpose in order to finish his shift at exactly 8 a.m. This issue is in breach of the Ambulance Service Act Section 3D, subsection A. Not responding in a timely manner means the patient does not receive treatment and care early and can result in deterioration. In addition, Mr. Wright's colleague had been waiting outside his home to be collected for a call for approximately 13 minutes. However, when he was asked the reason for the delay, Mr. Wright stated he was watching the rugby and that there was 2 hours on the job. This indicates that Mr. Wright did not inform his colleague that the call should be attended within 2 hours and caused delay. This issue is in breach of the Ambulance Service Act, Section 18A, subsection 5A. Mr. Wright also delayed checking the ambulance equipment with his colleague for 10 minutes on 2 separate occasions. Vehicle inspections must be completed on a daily basis in order to check the equipment is working efficiently and supply is adequate before leaving the station. Not conducting a proper vehicle check allows for faulty equipment and puts patient safety at risk. It is clear Mr. Wright has demonstrated misconduct by delaying his response time to calls and performing vehicle inspections. Mr. Wright was reluctant to use lights and sirens when travelling to emergency calls and transporting patients. In Queensland, dispatch codes that are categorised as Code 1 require lights and sirens with an immediate response without delay. As Mr. Wright was unwilling to use lights and sirens for emergency calls, he is ultimately delaying the response and placing the patients in his duty of care at risk of serious complications. This issue is in breach of the Public Sector Ethics Act, Sections 6B, 7A, B and C, and 9A and B, as well as the Ambulance Service Act, Section 18A, subsection 1G, Part 2. Therefore, Mr. Wright has evidently displayed professional misconduct and negligent actions by not using lights and sirens appropriately. With the evidence provided and cases brought forward to trial, the Conduct and Competence Committee came to the conclusion that Mr. Stuart J. Wright was guilty of negligence, delays to respond, and failure to appropriately use the lights and sirens during an emergency. Due to both these example incidents and other episodes of misconduct, this trial resulted in Mr. Stuart J. Wright being deemed unfit to practice as a paramedic, and he therefore was struck from the paramedic register.